Hi, and welcome to the Well podcast, where we explore whole person healing, body, mind, and spirit, and share real conversations that inspire hope and empower change. I'm your host, Laura Lee Wallace, the physical therapist here at the Well, and today I have the absolute joy of sitting down with Savannah Kenny, our family nurse practitioner. Savannah brings such wisdom, compassion, and depth to the care she provides, and her approach to primary care is anything but ordinary. In this episode, we'll talk about what it means to truly listen to a patient, to uncover root causes instead of just chasing symptoms, and to weave together conventional medicine with integrative tools that promote lasting wellness. We'll also dive into Savannah's own journey into nursing, what led her to the Well, and how her faith shapes the way she shows up for her patients every single day. Whether you're someone navigating chronic health issues or just seeking more thoughtful, hope-filled approaches to your care, this conversation will speak to you. So grab a cup of tea, get comfortable, and join us as we talk about healing, connection, and the power of treating the whole person. Savannah, I'm so excited to have you here today. You're such an important part of what makes the Well so special. But before we get into all the meaningful work that you do, can you start by telling me a little bit about yourself? I'd love to hear more about your journey, what first drew you to nursing, and what led you into primary care.
Hi, Laura Lee. Thanks for having me. So I got into nursing because at the time I was living in San Francisco and I wanted to move back home. I was born and raised in Siskiyou County. I was born here in Yreka and I grew up in Etna. And I hated living in the city and I was ready to move home. So I started trying to think about what I could do that would bring value to the community, help me make a mortgage payment, but be able to move home and be of service. And so UCSF has an advanced program to matriculate people into family nurse practitioner. And so I applied, never thinking that I would get in. And I got in. And so I became a family nurse practitioner in 3 years. And around that time, I actually met my husband and then we moved up here. So what I really wanted to do with primary care was be helpful. I mean, I grew up in Etna and the clinic in Etna had revolving physicians. There was always somebody new. And I had so many family members who were really disappointed that they had to tell their story over and over again. And they couldn't really connect with somebody because 3 years down the road, that person would be gone. There was just such a high turnover. People were really disappointed with their care. And I thought, I'm going to go home and make a difference. I'm going to stay, form relationships with people. And yeah, that was really what brought me back home.
So you were an important part of my journey to the Well. We first met during the pandemic, which was really a dark and uncertain time for both of us. And we ended up being two strangers who found strength in each other. We were able to encourage each other and even find a sense of purpose. Looking back, I see how God was weaving something together even then. What connected us so deeply and ultimately brought us to the Well is that we share the same heart for healing. We both believe in caring for the whole person, not just their symptoms. What drew you to this kind of integrative model? Was there a defining moment that made you realize this was the kind of work that you were meant to do?
I would say I had an interesting journey into primary care. So I actually was a pre-med major in my undergrad, and I was thinking I was going to go to med school. But while I was in school, I chose to major in exercise biology at UC Davis, and I minored in nutrition. And at the time, you're just trying to get your classes for pre-med, but I had an exercise teacher that was phenomenal. And so I had this big focus on health. And when so fast forward, I graduate nursing school, I move back home, I start working in the clinic, and I really started to realize within a couple of months, the things that I had been taught to do were not making people better. A really good example is I had a heartburn patient who was having terrible heartburn, and I am taught to prescribe omeprazole. We start him on Prilosec, and that patient came back 2 weeks later and said, it worked for a little bit, my heartburn's back. And the plan was just to advance it. So I increased the dose, and then I sent him to a specialist, and the specialist increased the dose. And I just remember thinking, we're not doing anything for this patient. Like, it's now been 6 months down the road. He's on a crap ton of this medicine, and I haven't done anything except put him on medication. And so because I had this background of nutrition, I started, even early on talking to people about their diet, because it's such an under-recognized important pillar of health. And so I would be spending way more time than I was allotted in the clinic to really go into people's diets, because how can you just prescribe a medication without talking about diet? And we don't typically have that kind of time. So that was just one of the big things, is realizing I wasn't making an impact. I was just writing prescriptions, and I was kind of horrified.
Well, being a nurse practitioner gives you this really unique opportunity to walk alongside people through every stage of life. How does that role allow you to serve patients in a more personal and lasting way? What do you love most about the continuity of care that you have really strived to create? I know that you were trying to do that at the clinic, but you're also trying to do that at the well. So kind of talk about what that looks like for you.
So the reason I decided to be a family nurse practitioner is we are trained then on pediatrics. So I can see a person from birth to death, whereas there's other specialties in nursing that's called adult geriatric nurse practitioner, and they're not taught any of the pediatric portion. So again, being from here, I knew that there's not a ton of providers in the area, and I didn't want to limit the ability I had to see people. And the nice thing is you actually get to take care of a family, because so often how the family dynamic is going plays a big role in that person's health. And so if somebody really likes me as a provider, oftentimes they want to bring their family. And then not only do I get a better idea of really what's affecting their health and, again, the family dynamics, but they like somebody. And if you like a provider, you trust that provider, naturally you're going to want to bring your whole family. So I think a big thing for me was I didn't want to fracture care. Like, you come see me for this, but you're seeing so-and-so for that. And that gets hard because there's just too many cooks in the kitchen. You don't really know what someone else has told that person. Not that I want to take over and do everything, but I really think in health, you kind of need someone who functions as like a center point, So if you're seeing a specialist, somebody needs to be always advocating for you and knowing what your goal is when you're going to see all these people who all have ideas about what you should do.
Yeah, I think that's what's really unique about here is the care at the well seems to be all encompassing, and we really care about what's going on in your family, and you have that unique ability to do that, because I don't know that there's another facility in Siskiyou County where you're taking your whole family to see the same provider.
It's pretty rare. I mean, and really when I got into nursing, I had the vision of like the old time family doctors, the guy with the black bag that shows up at your house and takes care of your family. And when I was a little kid, I remember my family used to joke that I was going to be Dr. Quinn Medicine Woman because I used to ride horses all the time. And they were like, you're going to be like that person that just goes out to people's houses. And that's really what I wanted. I wanted to be able to go see older patients in their house if they've got mobility issues, and not just be, a doctor in the hospital.
Primary care at the well, it definitely doesn't look like that quick 15-minute visit and a prescription. How would you describe your approach when someone walks through the door? What can patients expect that might feel different from what they're used to?
I would say our approach is different because we have longer appointment times, and I don't rush people. One of the things that I always felt doing the 15-minute visit was, especially if I hadn't seen a person before, they have to decide if they like you and if they trust you before they ask the real question. And so here, often, we have kind of padding built into our schedule, but I don't cut people off. So I like the opportunity to allow people to talk. I try to share a little too so they can decide if they like me. I think it's really important that people trust me, and they're not going to trust me if they don't know me. So I don't overshare, but I try to be a part of that conversation so they get an idea of who I am as well.
I think we saw a lot of people during the pandemic that really lost trust in their care providers. And the fact that we can spend time with people allows that trust to be developed again. And I see in my own practice here, a lot of people coming in who are sort of fractured and they're like, I don't know what to share. I don't know where to go with this. And I love that I don't have to cut people off. Like we're going to visit, we're going to have a conversation.
Yep.
I'm going to help you.
Yeah, I think it's a big thing. I grew up a lot with my great-grandparents, and I have all these wonderful memories of people sitting down and visiting. And it's kind of like that. Like, I want to know about your life. But I'm also, we're actually taught in school not to share. You're supposed to be kind of aloof. You're supposed to keep yourself distant. And I have a hard time with that because of all the trauma I think people have had in medicine. I want you to know who I am, because if you don't trust me and you don't like me, then what are we doing? It's supposed to be a relationship where we're helping one another. I'm giving you guidance. I'm helping you go through your labs, whatever. And there has to be some sharing involved. So one of the things I really try to do is form a relationship with people. Because again, you're not going to listen to what I say if you don't like who I am, or if you don't know who I am, or you don't believe me, or know where I'm coming from, or what my values are. So it's a big deal to give people the space and the time to talk, really listen, and decide if this is a relationship that they want as well.
You see everything from fatigue to chronic illness. And I love how all the providers here at the Well really take time to dig deep. Can you walk us through how you approach some of these common health concerns differently than the traditional setting might, or how you might have done it when you were in the traditional setting?
So I think the important distinction is what we're taught in school and the traditional setting is really based around frameworks. So versus annual visit, we already have a template of things that are our priority just based on schooling and different care models. So for instance, if you come in for an annual visit, I would be making sure you've had your pap smear. Have you had your basic metabolic screenings? Have you had your colonoscopy? There's certain things that your medical provider is taught to always be sticking to. And here, I kind of let patients guide that. So I'll have people make an annual visit, and I'm still going to go through the cancer screenings like I was taught. But if you're not interested in colonoscopies, I'm going to talk to you about alternatives and what are some other things and what's the risk and what should you be worried about? What could you do different? And then I'm also going to spend a lot more time talking about the basics because, if you're coming in for fatigue, which is a great one, if you're not doing the basic healthy things to make sure that your metabolism is working, nothing that I'm going to prescribe or tell you to take is going to do any difference. You really need to figure out, for any symptom, what is causing the symptom. That's really getting at the root. If you're having heartburn, is it because you drink a pot of coffee every morning and you don't eat and then you smoke cigarettes all day? There's something going on that is triggering your body to make a symptom to tell you that you're doing something wrong. So I want to know all those things. What are you eating? Are you sleeping? Are you exercising? Do you have joy in your life? There's all of these things that are very critical to you. So every visit looks different depending on that patient, but every visit I'm basically hitting those things. Are you sleeping? Are you eating? What are you eating? Are you moving your body? And then from there, we'll kind of extend outward. Do we need to do more advanced testing? Do you have a strong family history of cancer and you're really scared about breast cancer? Then we're going to order different screenings for you based on what you want, what's your goal, versus another patient who that's not their priority. So what we can do differently here is that I'm not required to make sure you're doing things that maybe my employer is prioritizing. Here it's, what do you want? What are your health goals? And I can tell you everything that we would do in a traditional setting. And then I can tell you a lot of what we do alternatively. And at the end of the day, what do you want to do?
So it's patient-centric versus protocol-centric.
Pretty much. And actually, I struggled with that in the beginning. When we first started, I had this big template of what I was supposed to do. And I got out here and it was like, oh gosh, what do I do now? I've lost a lot of faith in some of the things that I was taught, and I wasn't really helping people with that model. So I think the last 3 years have been just a huge growth in knowledge of alternative things. I've taken extra courses in hormones, which has been hugely helpful, because we're not really taught anything about that. I already had kind of a base in nutrition, but I've done a lot more down the rabbit hole on different nutrition approaches. So I think we have so much more to offer people, and then we have a longer appointment to actually talk about it instead of just that 15-minute gloss over and a prescription.
Okay, so now that we've talked about, how we're different and that we spend more time, let's talk a little bit about if I come to you as a 49-year-old woman and I'm really struggling with chronic fatigue. How does my treatment with you sort of progress?
So usually what I'm doing with people is I have an hour-long visit for the first visit where I'm looking through medical history. I want to know where you've been, who you've seen, what they've done, what you've tried. I want to know kind of where you're coming from. And then I want to know what you're doing. So a big one would be, are you getting enough sleep? Next, we talk about what are you eating? What kind of diet do you eat? I want to know a lot about GI function. Do you have stomach stuff, gut stuff? I want to know if you're moving your body. I want to know if you have joy in your life. What do you do? One of the questions I ask people is, what do you do all day? What do you do with yourself? And then what's your situation like? Do you have stressors? Are you working 2 jobs and you've got 2 kids? Like, what is your day like? So it's a lot of talking that first visit, really trying to figure out where people are. A lot of times we'll start with blood work if they haven't had blood work before, because then we get an idea if they're healthy metabolically. Do they need to make changes? Are they deficient? We see a lot of vitamin deficiencies. A big one that I always try to address at the first appointment is sleep. If you are not sleeping, sleep is the most critical. And it really doesn't matter, again, what we do. If you're not sleeping, you have to sleep. Sleep is so important. So we're kind of really always working on the base. We're working on the basics. So then I typically have people back to follow up on their blood work. And then I check in if we've done anything at that first visit, if I've recommended they start anything. I'm always wanting to know if anything's made a difference. Are they sleeping better? And then we go over blood work in detail. I write them notes, I write them a plan, and then we really kind of figure out what are we going to do. And chronic fatigue, we're really, again, trying to hit the basics. If you're not sleeping, we're going to make sure that we get you sleeping good. If you're not eating well and you're metabolically unhealthy, we're going to address that. If you're not moving your body, you get a prescription for exercise. So we start really with the foundation, because a lot of the things that we see are issues with foundation, which sometimes can be challenging because sometimes patients don't want to hear that. I think we all instinctively know that we need to probably sleep more and not look at our phone, and probably not eat those donuts, and probably go for a walk. And it's hard. And so I do sometimes see patients kind of struggle with that, but it's more from a place of education. Like, this is why it's so important. This is what your brain does when you sleep. This is what your body does with carbohydrates and fats and proteins. So every visit too is kind of like an education session. Like, I'm not just going to tell you what your blood work is. I'm going to explain it to you, because this is your body and you need to know how it works and you need to know why it's important. And I think you should know what I'm looking for. Because I think, again, the medical relationship is a relationship. It's not, it shouldn't be a relationship where I just tell you what to do. It's a relationship where I'm trying to teach you the knowledge that I know so that you can take care of yourself. So typically, we've got that first visit, then we'll do the follow-up visit to go over blood work. Then, depending on what the patient's plan is, I might give them a chunk of time to just go live, go do these things that we've talked about, and then see them back in 3 months. If they need more support, we might follow up in a month. It really depends on how much they need, and how well they're responding to things. If I get somebody that says, I'm doing everything that you told me and it's not working, then we start to think about different kinds of testing. Maybe we need to go down some different pathways. And there are definitely cases where we might refer that patient to neurology, or, if something else comes up, they may need to be seeing a counselor. We don't think that we can do everything. And there's definitely times where we might need to get that person connected with a specialist. But again, I think a big component is the time. It's not just, oh, you're tired. It's probably chronic fatigue. I'm going to give you that diagnosis and then probably give you some antidepressants. It's so much more than that.
So it sounds a lot like your foundation is lifestyle. And I come to you as a 49-year-old woman, and I am eating processed foods because I don't have time to cook a healthy dinner because my kids have to run to sports. And I'm not sleeping because I have a lot of stress at work. But it sounds like what you're doing is you're providing a lot of education. So I better understand how those things play into my life. And through that understanding and curiosity, maybe I'm a little more motivated to try those things.
Yep.
What if I come back at 3 months and I really haven't been able to implement? Thank you. Implement those things. I'm really struggling with that. So, does that mean that you can't help me?
I think a lot of times those sessions turn into kind of coaching sessions. And oftentimes I'll sit down and say, okay, tell me what you're doing. Okay, you're running kids to basketball at 7. You're off work at 6:30. So there's no time for you to make a dinner. What can we do? Can we shift and maybe have you do fasting? Is that something that we're trying to address for that person? That's the nice thing about having time is I'm not going to say, oh, well, if you're not going to do what I say, then we're done here. It's going to be, okay, if this is really the struggle point, can I help you figure out some way to make this happen? And the nice thing about sports is typically they're seasonal. So she'll be done with sports at a certain point, and if we can't really figure out the food thing, can we at least get sleep underway? Can we get your sleep nailed out? So there's always, sadly, there's always something that we could be better at. And so I'm not going to browbeat you over not being perfect because Lord knows I fall off the wagon too. And we're all doing the best that we can.
So it sounds like you're meeting the patients where the patients are at.
You have to. Otherwise, it's not a relationship.
At the Well, we do a lot of different testing. We use some really amazing tools that when I was in allopathic medicine, I never actually saw these things. We go way beyond basic labs. Can you talk about how you use these to get a clearer picture of what's going on in the body and how that informs or directs your different treatment plans?
So we are in a cool time right now, I think. There are so many tests out there. There's an overwhelming number of tests out there. Some of the ones that we really like to use because we're doing bioidentical hormone replacement is like ZRT saliva testing. So there's even things that people can purchase online now. So I've seen patients who've done like an Everlywell test online and they'll bring their results in. So hormone testing is a big one just because that's the population I'm seeing more of, which is in-depth hormone testing with either saliva, urine, or blood, and their take-home kits, which are very cool. We're starting to also do a lot more with GI testing. So that's I love to call it the poop in a box test, where people get to take it home.
You just really sold that one to everybody listening.
But it gives you such cool information. Are you digesting your food? Who lives in your guts? Do you have any pathogens? Do you have any bacteria, parasites? So many people have disturbed microbiomes. So that test is very cool and very helpful for many people. There's a lot more immune testing coming out now too. So we've got some patients who, despite doing all the things that we've talked about, we just can't seem to figure out what's going on. And so we'll do more in-depth testing with like immunosciences and some of the different labs where we're looking at their white blood cells. And really, once we get to that point, I tend to hand people off to Dr. Sander because I'm a primary care provider. And so I feel like I've worked with hormones. I've done extra training in hormones. But when we start getting down the road of immune dysfunction and Lyme's disease and some of these bigger ones, I will tend to have people see our integrative MD, Dr. Sander, just because there's so much to learn. And I don't feel confident with the depth of some of these testing. And I don't want to oversell my capabilities. So I can definitely say, oh, gee, I don't know what's going on. Let's order this white blood cell map. And then I'm going to have you see Dr. Sander to go over it because we've done all the things that I know and you're still struggling. So I'm going to tee you up for Dr. Sander. So there's, like I say, there's just so many tests out there that it makes me sad to think when I first started, I'd just order the basic labs that we're told and be like, oh.
You work in our Yreka office, and in our Yreka office, we have your primary care in addition to Dr. Sander, who does the integrative medicine, which is what you were just talking about. I do the physical therapy, and we also have a massage therapist here. We have acupuncture available up in our Ashland clinic. So I'm just kind of wondering, what makes us so unique is this ability to collaborate with so many different practices under basically one roof. Can you share how you collaborate with the team and how that benefits the patient?
So I think an easy example of that is like seeing a primary care patient for a sprained ankle. We had a girl sprain her ankle and she came in to see me so that I could order x-rays, and I came and grabbed you to look at her ankle just to give her some tips right now, because if it's not broken, she's probably going to be doing physical therapy. So I think that's been a really nice way to tee people up to physical therapy, because physical therapy is really the first step for a lot of aches and pains and joint stuff. And then with Dr. Sander, there are definitely times where we get tough cases and I will basically run that case by her. So if I'm out of my depth, I talk to her about what's going on, and she can usually give me some pointers, and then I may need to actually hand that patient over if it's over my ability. So the ability to talk to other people in the moment, a lot of times we still have that patient in our room, like, hey, I know Laura Lee's here. Let me have her look at your knee really quick. Or, hey, I'm going to go ask Dr. Sander. And I know Dr. Sander has grabbed me on occasion to look at skin stuff because skin stuff is hard. So you're kind of getting all of us in one visit, which is, I think, a big thing that sets us apart is you're coming to see me, but you actually might see the physical therapist too. And you might see Dr. Sander if I can catch her and I've got a question, or you've asked me something that I can't answer. And then now that we've got massage here too, I have had people, some headaches, tension, sometimes people who are just really going through a lot who need a massage. It's been really nice to send people to massage. And then with Bo up in Ashland doing acupuncture, that's also wonderful. There's so much evidence behind acupuncture, and it can benefit so many different things, and it's not that far away. So if somebody really wants to stay in the well, they can go see Bo up in Ashland, or we even have local acupuncture providers. But yeah, having the team is huge.
You have such a gentle and encouraging spirit, and I see how patients really open up to you. What do you love most about the relationships that you're building here with your patients? And how do the connections shape the care that you give?
I think the relationship that I am always really striving for with patients is authenticity. I have never been one for fake people who are nice to your face and don't remember your name. And so when I meet patients, I genuinely want to know about them. I want to know who they are. And I know patients have seen doctors where they ask you the medical history questions, but they don't really seem to be invested. And I think I'm different in the sense that I'm really invested in people. And, I'm the same person in the well that I am when I'm shopping in Rayleigh's. I'm not putting on a front. I'm truly sitting there with people and giving them the space to talk. And I think people really respond to that because so many times people really just need to be heard, and I can give them the space and genuinely listen and be present. And so I think that's what I'm always striving for. I want you to feel like I heard you and I care about you, and I'm in this relationship for your health.
We've talked a lot today about how the well is different from allopathic medicine and also from other integrative medicine practice. One of the other things that sets us apart that we haven't really talked about yet is that we're really a Christian-based practice. Can you talk about how your relationship with God guides the way that you care for your patients?
I feel like I'm fairly new to Christianity since the pandemic, and how dark things were for me was really when I feel like I truly became a Christian and really started reading the Bible and trying to figure out what's the purpose of life? Why am I here? All of those big questions. And as I have started down that journey and really looked to the Word of God, one of the things that I have really taken away is that God's message to us is that we are to love one another. So when I see people, I'm always coming from a place of love. And that goes into the giving people space to talk, valuing what they have to say, because that really seems to be the underlying piece of Christianity that makes it different from so many other religions. So that's always what I'm thinking of when I'm thinking about God in that setting with people.
Being a Christian-based practice, does that mean that you need to be Christian in order to come here? Does it mean that when you're in a visit that you're going to be talking about God or biblical principles? How does being a Christian-based practice actually come into your visit outside of you loving on your patients?
I really let people guide that. So it's up to the patient. I don't preach to people. I don't tell them they need to think a certain way. And I've got a lot of patients who maybe aren't Christian, and that's fine. I think the biggest part of it is I'm willing to talk to people about that if that's something they want to talk about. Conversely, in a traditional healthcare setting, that's not something you talk about. And I remember in school, we were taught you don't talk about that stuff. That's not why they're there. It's very divorced. And here, it's not divorced. It's a big part of who you are. And even if you're not a Christian, even if you hate God right now, even if you are atheist, I might give you a door to open, but it's up to you if you want to go down that path. We're still going to talk about your health. We're still going to talk about, all the basics that I've already talked about. And I'm still going to ask you what's going on in your life. And, if you're finding joy, if you're living your life and being happy. So
I think being a Christian-based practice, in basically what you said, is it's really our principle. We operate the well based on Christian principles, but it's not what someone needs to bring through our doors.
Right. And I think that there's been people who maybe were a bit put off because we've stated that. And I think it's just so different. There's no other places that say, hey, we're Christian. But I think what we're doing is we're kind of setting the expectation. This is what we believe. You don't have to believe it, and we're not going to judge you if you believe or don't believe. But it gives people who do believe, I think, some peace, and there's just a depth there.
Well, and the ones who do believe tend to come into the room and open that door. They'll
Correct.
ask to be prayed over. But like you, I do the same thing. I let them sort of open that door.
Yeah.
We're getting ready to close this out, Savannah, and I want to ask you, what's one thing that you wish more people understood about their health, and what is something that they could know that would help shift their mindset or give them confidence to move forward towards better health?
I think one of the things I like patients to know is that where you're at now isn't where you're always going to be, and that your body is always changing. So, all of our different cells renew every so many days. So you're literally building a new body every day. And so it's really the little things that you do each day that make a big difference. And so I'm always starting with basics. Are you sleeping? What are you eating? Are you moving your body? Because those are the things that at a cellular level promote health. And so I think when people start making healthy changes, it feels very overwhelming, but really it's making better habits and then always working towards one of those things, getting your sleep fixed, getting more active, eating better foods. So I think I don't want people to feel overwhelmed. Start with something and just always keep working towards better, healthy habits.
I think I would like people to think or to know that their body has an ability to heal and that it's communicating with them and it doesn't have a voice. All it has is symptoms. And so when you come to the well, what everybody's working toward is really trying to get to the bottom of what that symptom is trying to tell people.
So, right, symptoms are your body's way of communicating with you. And one of the things that's really rewarding here is that when I start seeing patients and they are starting to make those healthy changes, what we are looking for is seeing results, seeing resolution of those symptoms. So for a lot of these patients, we're getting them off of their medications. I see a lot of older patients who've been on blood pressure medications for years that they don't need, or cholesterol medications, or maybe they had pre-diabetes for years, and we're actually giving them the tools to stop those processes. So we can reverse pre-diabetes. We can reverse type 2 diabetes. And we can reverse high blood pressure. We're giving people the information that they need to make changes in their life to see healthy outcomes. And I always tell people my goal here is really to not see you. As much as I like you, I don't want you to come back all the time. I don't want you to come in for a well visit. Really, I want you to go live your life, be healthy, and if you need me, come in and see me. But if I don't teach you how to take care of your body and I just put you on medications, I've made you a patient who needs to come back to me every 6 months or a year, and I'm generating revenue. That's not my goal. And I don't think that's any patient's goal. My goal is to make you healthy, get you off of all those drugs, and have you be a healthy, functional person. And it's really exciting that we are getting the people here who want that for themselves. And we're getting to see them stop their medications, be healthy, and see their symptoms go away.
Savannah, thank you so much today for coming and sharing your heart and your wisdom and your deep compassion. Your words are a reminder that healing is possible when we slow down, listen deeply, and treat the whole person, mind, body, and spirit. To our listeners, we hope this conversation left you feeling encouraged and a little more hopeful about your own journey. Whether you're just beginning to explore integrative care or you've been on this path for a while, know that you're not alone and that there are providers like Savannah who are walking this road with you. If someone in today's episode spoke to you, please share it with a friend, leave a review, or reach out to us at The Well. We're here to walk with you in your pursuit to healing and wholeness. Until next time, may you be well in every way, mind, body, and spirit. We'll see you on the next podcast.